Okay, so I did my infomercial on marijuana, also known as cannabis. So, marijuana comes from dried out leaves, stems, flowers, and seeds from the hemp plant. Cannabis is a plant that has uses as a recreational and a medicinal drug. Cannabis contains at least 120 active ingredients or cannabinoids that produce euphoric or psychoactive effects. There are two of the most abundant active ingredients, one of which is called delta 9 tetrahydrocannabinol, also known as THC. The THC is the main psychoactive chemical that is found in resin produced by the leaves and buds of the female cannabis plant. The second most abundant ingredient is cannabidiol, which is also known as CBD. There are different types of marijuana, so the first one that I'll talk about is sativa. Sativa has lower doses of CBD with a higher dose of THC. So, sativa produces a mind high, which means it gives off an energizing, anxiety reducing effect, and it makes the user feel more productive and creative. The next type is indica. Indica has higher levels of CBD and less of THC. So the user may feel intense, relaxing effects, which can reduce nausea and pain and increase their appetite. Indica is better consumed at night because of these relaxing effects. The third type that we'll talk about is ruderalis. So ruderalis typically has little THC and higher amounts of CBD, but not enough to produce any effects. And because of its low potency, it is not used for medicinal nor recreational purposes. Rather, it is used to make hybrids, which is the next type that we're going to talk about. Hybrid plants are grown to increase the percentage of THC, but each type has a unique ratio of THC and CBD depending on their parent plants. The effects can range from reducing stress and anxiety to easing symptoms of chemotherapy. So, how can it be used? Smoking or vaping via joints, blunts, or wax pens, handheld pipes, water pipes, which are also known as bongs, consuming it in the form of an edible, applying it as a topical treatment, such as a lotion or a cream, with vaporizers, and also with concentrated resin. As stated before, marijuana is used for medicinal purposes, so it helps to manage chronic and ongoing pain, nausea, and vomiting resulting from chemotherapy, stiff muscles or muscle spasms from multiple sclerosis, low appetite, seizures from epilepsy, anxiety, sleep problems. So, short term effects of marijuana last between 1 to 3 hours. So, this is known as the high. The THC in marijuana stimulates the part of your brain that responds to pleasure, which causes the release of dopamine, giving the user a euphoric or relaxed feeling. But it is not always that simple and relaxing, since some effects can include anxiety, fear, panic, paranoia, hallucinations, which happens when a person either takes too much, is inexperienced, or the marijuana is has an unexpectedly high potency. Some other short-term effects are a lowered reaction time, problem with coordination, increased heart rate, which may cause an increased risk of stroke. Long-term effects of marijuana include heart problems, bone health, mental health, cognitive problems, breathing problems, cancer, and more specifically, testicular cancer. So, some risks associated with marijuana use are dry mouth, dry eyes, dizziness, lethargy, a decrease in blood pressure, impairment of judgment with a higher chance of having a road traffic accident when driving within 3 hours of smoking marijuana. Frequent cannabis use may affect the immune system's response. Gum disease, smokers of potent strains may have a higher risk of acute memory loss, increase the risk of testicular cancer, and in pregnant women who smoke marijuana, risk giving birth to underweight or premature babies. And